The Registered Nurse Safe Staffing Act of 2015. Nurse to patient ratio. Nurse to patient ratio refers to the number of patients a single nurse can be caring for on a floor at one given time. This number varies based on which hospital you work at, or can even vary depending on which state you live in. The baseline ratio is generally one nurse to four patients. There is currently no federal mandate on the required nurse to patient ratio in hospitals. As of 2018, there were only 14 states that had laws addressing safe staffing in general, but not specific to nurse to patient ratios. As of 2020, California was the only state to have a law implementing a mandatory minimum staffing level, and this was due to the passing of the Registered Nurse Safe Staffing Act in 2015. This act requires that each participating hospital has a nurse staffing plan in place, which is created and regulated by a nurse staffing committee. The act also requires that at least 55% of the committee is composed of registered nurses, including nurse managers and at least one nurse from each specialty unit. The job of the committee includes evaluating the staffing plan at least once a year and making modifications as needed. The issue of proper nurse to patient ratio impacts nurses as individuals, but also the entire nursing profession as a whole. A significant problem with not having a proper nurse to patient ratio is that nurses become burnt out. In a study conducted by the PRC National Nursing Engagement Report, 63% of nurses said that they have experienced burnout, and 44% of nurses interviewed stated that they worried their tiredness could compromise their care of their patients. As a profession, proper nurse to patient ratios enhance the image of nursing because of public trust. Because nursing is regarded as the most honest career with the highest ethical standards, nurses have an obligation to ensure that they are improving the health and well being of the general public. When patients and their families enter a hospital, they trust in the healthcare providers to be giving them the best care possible. If the nurses are burnt out or overwhelmed, the patients do not get the attention that they deserve and need. A proper nurse to patient ratio has a significant impact on patient care and the community. As nurses, safety of patients should be the number one goal of our care. Because California is currently the only state with ratio mandates, the data found there should serve as a baseline to monitor the effectiveness of ratios on increased patient safety. One study showed that if New Jersey was to implement the same ratios as California in their med-surg units, we would see a decrease of almost 14% in patient deaths. When nurses have a proper patient ratio, they are able to spend more one on one time with their patients. This creates a safer environment for both patients and nurses and can reduce the risk of avoidable medical errors such as pressure ulcers, patient falls, and hospital acquired infections. Higher numbers of patients per nurse was also strongly associated with administration of the wrong medications. The nurse's role regarding this issue is to advocate for what is best for the nursing community as a whole and the patients we care for. The American Nurses Association supports state safe staffing laws, including mandating specific nurse to patient ratios into law. In 2015, the ANA publicly endorsed the Registered Nurse Safe Staffing Act during a visit to Capitol Hill. An endorsement from one of the most well known nursing associations shows how important this issue is to the nursing community. Another organization that could be involved with safe staffing is the Department of Labor. It is their responsibility to enforce laws that protect the safety of workers, and reducing nurse burnout and preventable medical errors could help to achieve this. As with any issue, there are positives and negatives. The pros of proper nurse to patient ratios include increased patient safety, decreased preventable medical errors, and an increase in the overall happiness of staff. It has been stated that ratio mandates also improve nurse retention and the number of nurses willing to work. A con of mandating the Registered Nurse Safe Staffing Act is increased costs for hospitals. The need for additional staff means an increase in financial needs to pay their workers. The cost of increasing nurse staffing to safe levels had less than a 1.5% increase. Although there is an increase in cost, it does not seem significant in comparison to saving lives. The Registered Nurse Safe Staffing Act has ethical principles to consider as well. The ethical principles relevant to this issue are beneficence and non maleficence. Beneficence means to do good for patients, which includes patient advocacy. Supporting this act does good for patients because it ensures safe and quality patient care. Non maleficence means to do no harm to a patient. Proper ratios eliminate additional factors that could put a patient at risk for harm. Safety should be the most important focus of all healthcare workers, and the Registered Nurse Safe Staffing Act aims to protect the safety of both patients and nurses. Proper nurse to patient ratios have endless benefits to the nursing community and patient care and should be mandated across the country. The best way to ensure safe healthcare for all is to advocate for protection of nurses and patients by any means possible. Thank you.